no warm-up.
There wasn't.
I just hit go. Are you going to do it?
No, I'm not.
Fine. I'm going to do my thing then.
Okay.
I wouldn't leave it for nothing. Only a crazy man would. So if you catch me in your city, somewhere out in your hood, just say smile for me, girl. What you looking at? Let me see your grill. Let me see my what? Yeah, your grill. Your grill. I brought out the jewelry store and tell them make me a grill. She said smile for me.
We gotta turn it off before we get in trouble. We're kind of crooked. Why are we crooked? I don't know. Whatever.
It's because we didn't do a warm up. You just pushed the button.
I just said, let's go. Let's go.
Oh.
Good?
No, I think we're still crooked. That's okay. No one's watching us.
This is the quality of our production again. It's fine. You
So
know
why that song?
because we're going to talk about some teeth. Not our teeth.
No.
Animal teeth. Your pet's dental health. I'm going to spill my coffee too. This is dangerous. By the way, the Panera free coffee through September situation is dangerous, but it is delicious.
Mm.
So we had a question about just dental care in general in pets. So we thought we would talk about that today. So what sort of things with regards to dental care would you like to talk about?
I think just like overall benefits of dental care.
Okay.
I know a lot of people don't understand that kind of thing and why it's important for
Sure.
their animals to have good dental care.
Mm-hmm.
I personally think that dental pain is one of the worst things when you have it.
Yeah.
It's like throbbing and
Yeah.
just awful.
Yeah.
So I think that's really important.
Okay.
And then what we do to prevent and maintain and treat. Yeah.
Yeah. Okay. So let's talk prevention first. So that's always your best first step is just to prevent problems before they happen. And certainly there are certain animals as individuals, but there's also certain breeds that are going to be more prone to dental disease than others. And so sometimes despite your best efforts, it just is what it is, and they still end up coming to see us for professional care. But that being said, it's something that, I'll admit I'm not great about home care on my own pets. There's things that I do that are easy, but I understand that brushing is not always feasible for everyone. So that's what's great. There's a lot of different options now. Of course, brushing is the best. And there's a lot of different ways that you can do that. We brought props today. We prepared. We're not really prepared. We just brought props. So things like, using like the toothpaste. There's a lot of different toothbrushes available. When I'm doing brushing, I like to use the finger one personally. They have, ones that look more like a people toothbrush. But I feel like that's just weird for a lot of pets because it's just a big plastic thing you're shoving in their mouth. So they're usually a little bit happier about this. It's nice and soft and you just kind of rub along the teeth. And you only really have to get the outsides of the teeth. Don't worry about getting on the inside. Do you know why?
Isn't it because everything is it's gonna cover the teeth when they start like.
So the toothpaste will. Yeah, absolutely. But the brushing action, what you're doing with that is disrupting that initial plaque layer. So that slimy, when you wake up in the morning and your teeth kind of feel gross, it's that. What?
Nothing.
Oh, because you're laughing at me.
Well, yeah, I am.
But that kind of that slimy sort of feeling that you get, fuzzy feeling. That's what the brushing takes care of. You're brushing that off. That is a layer of basically bacteria and what's called a biofilm, so where the bacteria kind of live and hang out. You brush that away. So some animals don't like the toothpaste, and that's okay. You don't have to use toothpaste when you brush. You could just use a brush. You could also just use a damp washcloth or a little bit of gauze, or really anything that's going to wipe off that film, that layer, is going to be beneficial. It's going to help. So with or without the toothpaste. Obviously, things work better with the toothpaste because it's enzymatic. It's fancy.
Don't use your regular
Yeah,
toothpaste.
don't use your toothpaste. You use toothpaste that's made for dogs and cats, and they come in different flavors. This one's poultry. I've seen malt. I've seen beef.
You've got a mint.
They've got a mint. Yeah, vanilla mint smells good, actually. I
Yeah.
like that one. But yeah, so that's, you don't have to use the toothpaste, obviously. If you can, that would be best. But if you can't, that's okay. And really, even if you can't commit to every day, of course, just like us, brushing every day is best. But even if you just did it once a week, you know,
It's
or
gonna be
a couple
better.
times a month is better than absolutely nothing. So, you know, do the best that you can for sure. You know, the ones where they're getting their teeth brushed, they get the groomer every couple of months, probably isn't doing a whole lot for you. If they're going to do it anyway, obviously just let them do it. But I wouldn't pay any extra for it, truthfully.
Yeah.
Because by that point, it's, you know, that's, so what happens is the film that's there, that plaque, turns into tartar. So the difference between plaque and tartar, so again, plaque is more like the film, but as it solidifies and kind of concretes onto the teeth, now it becomes tartar. So now it's that like tan or brown or sometimes black looking, like chunky stuff that's on the teeth, typically starts in the gum line and works its way down and out. So that, you're not going to brush that off.
Yeah.
That's not a thing.
Once it gets to that point, really the only thing that's going to take care of it is a dental cleaning.
Yeah, is to get the teeth scaled and
Yeah.
polished. Yeah, so we'll talk a little bit about that in a minute too. Other things that you can do. So I like there's water additives available. That's nice because that's easy. You literally just add it to their water. Now make sure, especially with cats, they can be really picky about water. So I would offer them just plain water and then also a bowl with the additive in there. Just on the off chance they don't like the additive, I don't want them to just stop drinking because they will. Like I said, especially for cats, they're funny about stuff like that and they have different opinions. So I would do, you know, a bowl with this and a bowl without. Once you're sure that they're drinking with the additive, you can take away the plain bowl. That's fine, but start with that. But that's nice because this is, so basically it's like a rinse. So this is kind of like if you just used mouthwash daily. It's going to do something for you. It is not going to be the best, but sometimes something is better than nothing, and that's okay. So it's got some enzymes in there to help break up some of the plaque a little bit. Again, not as good as a physical, you know, brushing or wiping it off, but yeah, it helps.
Better
So
than
that's the
nothing.
thing. Yep.
Yeah.
And it makes their breath smell a little bit better, which is nice. Another thing that they've got in some places is this like gel. It'll come as a gel or a spray. Again, same sort of idea as the water additive where it's not going to physically break up that layer, but it can help. Yeah, and again, it smells good. I've
My
tasted
dog-
it. It tastes
yeah.
good. Is
My
that
dogs
weird?
thought it was weird.
They thought it was. They didn't like the gel.
They didn't
They
like
weren't a
it.
fan?
No. The water additive is great. I don't think that they really even noticed that
Yeah.
it was in there.
Yeah,
But this stuff, I don't think they particularly cared for.
yeah. And I do think, you know, at the point that you're able to do a gel, you should be able to do brushing,
Yeah.
truthfully. So, you know, for me, I would decide between, you know, doing brushing and then the water additive. You can do both things. You don't have to just do them exclusively. Again, you know, maybe you brush once a week and then you use the additive in between.
Yeah.
Cool.
They also make like some dental treats.
Yes.
And they make
Yeah.
dental
There's
toys
all kinds
as well,
of dental
don't they?
treats. I told you I brought props. One of the things that you want to look for when you are purchasing dental treats, and you're not going to be able to see it, it's too small and it's going to be blurry. Yeah, see, this is why I didn't bring my phone for the other things. Crystal, she made fun of me for printing out pictures. But there's a little seal at the top here that says VOHC accepted. Helps control tartar. So this two greenies I think have VOHC. There's a bunch of different ones available. But basically, what is VOHC?
I knew you
You
were
are
gonna
gonna ask.
I'm gonna take a guess.
Teacher situation.
Veterinary,
Mhm.
oral health care
Council.
council.
You were so
I
close.
was
though.
so close.
It actually says it on here. It's just really teeny tiny.
Oh yeah, it does.
But yeah, so they evaluate different products and decide, if they think they're effective or not. And if they're effective, they get the VOHC seal, the stamp of approval,
If you
Stamped?
will.
stamped approved. So chewing, is another thing. Obviously, to get full benefit from this, it would have to be a daily thing as well. Again, you could do this in between if you're doing your brushing once a week and then you're using your water additive and maybe they get a treat a couple times a week too. That's awesome because you do have to watch too. When we were talking about weight, these have calories. Yes, they are good for them, but they are calories. So if your pet is overweight, we're trying to limit calories. This would not be a thing to try to add in every single day.
Or you could cut back on.
Or you go to cut back on the food to make up for the
Yeah.
calories. Yeah, for sure. So lots of different preventative options. Can you think of anything else that I
Don't
missed?
they have different toys though that have?
Mhm.
Yeah.
Yeah, there's toys. I wonder if they have any of them in here. Probably not. No. So I've seen different toys that have basically little nubbins on them to do kind of that rubbing or brushing sort of motion. And that's something that is helpful as well. Yes. So
Yeah.
animals with food allergies or that are overweight, that you're wanting to use the chews, but maybe we don't want to have the calories or the ingredients that are in there aren't good for your pet's food allergies. That's something,
Yeah.
that you could certainly do. Yeah, absolutely. Now these we have because they are vegetable based, so they're less likely to have issues with food allergies. Because whereas food allergies are usually a protein issue, not always, not 100%, but a lot of them. So yeah, that's why we have those. Yeah, I did learn just something.
Yeah, you did.
So let's talk about. So we did our preventative. So what happens if, maybe we haven't been doing those things, or your pet is just one that has bad teeth. It's just how it is. Like I said, there's certain breeds that have really bad luck with dental disease. And it seems like no matter what you do, they're going to have problems. What kind of breeds are we talking about?
Like Chihuahuas,
Mhm.
Shih Tzus,
Mm-hmm.
a lot of little dogs.
Yeah. It seems like it's primarily the small breeds of dogs.
Yeah.
Although I will
Cocker
say
Spaniel.
Greyhounds have horrible mouths.
Yeah.
Horrible. I don't know what that's about, but they all get bad teeth. They usually end up losing a lot of teeth in their lives. So when you get to the point that, they have the tartar buildup, or the teeth are now just diseased, no amount of brushing is going to fix that. So at that point, you need to come see us. And we'll kind of get everything taken care of and get you back to square one, to where then you can use your preventative measures as maintenance to try to prevent us from having to do another professional cleaning. So what do our cleanings involve?
So they come in. They're gonna stay for the day.
Mhm.
They do go under general anesthesia
Why?
because we don't want to stick our hands in their mouths while we're trying to
Well, that's
scale
not
and polish.
That's not really the only reason.
We also do dental X-rays while
Yeah.
they're under anesthesia,
Mhm.
and there's a little probe that goes in their mouth, like a little plate, and that's what we use for the X-rays.
Mhm.
We don't want them biting that.
No, that would be bad. So there is an issue where there are places that offer what is called non-anesthetic dentistry. That is not a good idea. Do you know why?
Well,
Because what if my dog's really good? I'm not worried about the X-rays. My dog's really good.
we
and
don't want them
can-
swallowing.
We can scale and polish. It's fine.
We don't want them getting the water into their lungs either.
Well,
So we
yeah.
place a breathing tube
hmm
to keep that from happening.
Yeah. And there's just no way that you're going to be as thorough. There's no way. And, great that you can scale off, the tartar that's on the outsides of the teeth. That tells you nothing about what's happening below the gum line. So you can make them pretty, doesn't mean that you're doing that animal really a service. So that's where the dental x-rays come in. Same thing, if you go to your dentist, They do x-rays on you. They do whole mouth dental x-rays on you every time. And it's because a lot of dental disease happens below the gum line, to where you can't see that with the naked eye. So yeah, you can clean them up, make them pretty. It doesn't mean you addressed the pain and the infection that's happening in that mouth. So that's the important thing. So when we see dental disease, keep that in mind, that when we're seeing, gingivitis, and we're seeing that level of tartar buildup, or we're seeing gums receding away from the teeth, and we're seeing the roots of the teeth being exposed, that's painful. That hurts. That's a sign of infection that's there. That infection can spread elsewhere. That's big bad stuff. Icky. So it's not just stinky breath. It's a whole lot of health concerns go along with that. And left unchecked, we see things like heart disease, where they'll end up with infections on their heart valves. And now they have heart disease and can't go under anesthesia to fix, what's causing that problem. We can see issues with liver and kidney disease as well, as a result of dental disease. Because that gingivitis, so it's an inflammation of the gums, typically along the margin of the tooth, although depending on severity, could be the whole mouth. That opens up a really nice pathway for that bacteria to go into the bloodstream and end up elsewhere. So important stuff, not just dealing with stinky breath. Although the stinky breath is gross too.
It is. But I mean, can you imagine not brushing your teeth for
right. Yeah.
years?
Yeah, exactly.
Like,
yeah. If I hadn't brushed my teeth for 10 years, my mouth would be disgusting as well.
yeah. Gross.
Yeah. And there's some of them, God love them. We walk into the exam room and it just like hits you and you're like, oh. And you gotta try to maintain like you don't. Like it's not that level of
But
offensive.
I feel like a lot of times you get used to it.
Yeah.
So it's not
Yeah.
as noticeable
Yeah.
to you.
Mm-hmm.
So
Yeah. Or we had that one dog that the tooth just went flying out of the mouth. I was really horrified.
that was awful. That was so bad.
That's not a thing that should ever happen. If your pet's teeth are falling out of its mouth, it has dental disease. Yeah.
And it hurts.
And yeah, it hurts and they don't feel good. And that's the thing too with dental disease in pets. Again, going back to our discussion about pain, a lot of these guys aren't showing you outward signs of pain necessarily, although they can. If they're pawing at their mouths, rubbing at their mouths, chewing on one side, or decreased appetite, those are signs of dental pain. But a lot of them are eating just fine because they're built to hide that. So just because your pet's eating doesn't mean that they're not in pain. And what we find more often than not is, we look under the lip and we're like, oh, that's gross. Let's get that taken care of. After the procedure, they act like they're new dogs.
Yeah. Or
Cats.
feel
They feel so much better. And people are like, wow, it's like he, is
like a puppy again.
half his age again,
Yeah.
and it's because you don't notice that, maybe they're acting a little older, but maybe it's because they're in pain and not because they're just old. So that's a thing that we hear quite a bit. So when we do a complete oral health assessment and treatment, or a COHAT, most people just call it dental, it's not just a cleaning. So it's not just, we do the cleaning. So we do whole mouth dental x-rays, we scale the teeth with an ultrasonic scaler. They're also polished afterwards. Why?
Because we want to get all those little grooves and everything smoothed out so that the bacteria and things don't have stuff to hold on to.
Yeah, exactly. So all the scaling in that leaves little micro grooves that, the bacteria will more easily set up shop. Next time, they just grab on there. That'll be our thumbnail. So the bacteria, it's a great place for them to hang out and hide. And now it's worse the next time, it builds back up faster. So again, if you're just doing scaling, that's not sufficient because you're actually doing that animal disservice because you're just scaling off the chunks of stuff that's on the outside of the teeth. You're not buffing out all those little lines, and so they're actually going to get worse teeth more quickly.
It looks cleaner.
It looks cleaner.
Looks like you've done
Yeah.
great.
Looks better.
not
You
good.
didn't really help that animal. So that's an important thing to do, is the polishing along with the scaling. And then we probe around the teeth. We look for any kind of mobility of the teeth, so are they wiggly? We look for, are there pockets around the teeth where the bone has receded away from the root of the tooth? And depending on the depth of that pocket, sometimes there's some other things that we can do to try to improve that prior to extraction. Most of the time in a general practice, most of what we're going to end up doing if a tooth is diseased is extract the tooth, if it's to that level. There are veterinary dentists that'll do root canals and crowns and all kinds of fanciness. I think the vast majority of our clients, it's just outside the price range for them, unfortunately.
I wouldn't do it.
Yeah, no.
I mean, my dog had a fractured canine that took you
It took me so long to get
like
out.
an hour
Terrible.
to pull, but
It was
because
awful.
the rest of the tooth was healthy,
Mhm.
but it was fractured
Mhm.
and couldn't stay.
Yeah. So so that's something else that we look at with dental x-rays is, because there's different fractures that can happen, little chips and things that may not be significant, but we look at the dental x-rays and we decide from there, what needs to happen with that tooth. Because sometimes we find things going on at the root, so like maybe it didn't look so bad at the crown, so the part of the tooth that you can see is the crown, and the part that's below the gum line or in the bone is holding the tooth in, that's the root. Sometimes we see things with that changes our plan. We also sometimes see things like that make us say, I'm not touching that.
Yeah, that's gonna stay.
I can't tell. Can you see?
Yeah, you can.
Okay. You want to point it out?
Yeah.
You want to be my Vanna White?
So this is actually one of my dog's teeth. He's a
This is
Chihuahua.
Jaeger.
This is Jaeger. He gets his teeth done almost every year.
Almost every
It's
year,
like
yeah.
every 12 to 14 months.
Yeah.
He has to get his teeth done.
Because he's a little dog.
Yeah. So this here is actually, so all of this is the bone. And
Which bone is it?
what do you mean?
Which bone is it?
Mandible?
Yeah.
Is that what you were looking
Yeah.
for? Oh, okay. Okay.
We're getting high tech today.
So this here is a hooked tooth. So that tooth is actually hooking into his bone.
Mhm.
So if we were to try to remove that, the chances of breaking his jaw are pretty high.
Yeah, because there's just not a whole lot. I'm trying to do this backwards in the camera.
Where?
There's not a whole lot of so this brighter white line is basically the strong part of the jaw. So it's this lower edge here, and you can see how little bone there is between the end of that tooth and the edge of that jaw. So yeah, and especially with it being hooked like that, that could be really not fun to remove.
Yeah.
So that would be one that we would potentially, if he didn't need it extracted at all.
No,
Anyway,
yeah.
it was fine. It's a healthy tooth. But
But
if
he's
he
gonna keep that
did,
tooth forever.
he's either gonna keep that tooth forever, or he's gonna have to go to a dentist and get that done, or I learn how to do some
You'll
root
learn how to do
canals.
something. Because I'm one of those clients that it's out of my price
Yeah,
range.
and that's fine.
Do you
So
want me to hold
another.
this one too?
Sure. So this is another dog that, so this is, again, dental x-ray. We just blew it up really big and printed it out. So this little guy, he's the sweetest little guy. But we did his x-rays and we're looking at, so this is his lower jaw, again, the mandible. So these are his little incisors, so the front small teeth there. I don't know if you can tell from the camera. So there's a couple of roots here where the incisors had actually broken off. So if we had not done dental x-rays, we would not have seen those roots. You wouldn't have known that those were still sitting in there. And that can cause a problem. The other thing that we took this x-ray and I was like, ooh, is, so this is a canine tooth here. This is another canine tooth. This is a diseased canine tooth. And I know that because the center part of the tooth is whitened compared to what it should be, so it tells me that it is diseased. But what I'm also seeing is, so this is, again, strength part of the bone. Yeah. This should come up like that. There's no real bone there. So what would happen if we tried to extract that tooth is his jaw would break. It would break. And so that's That's bad. So we don't touch that here. We don't touch that here. Because too, you pull that tooth, and now his jaw's broken, and now we have difficulty with trying to anchor that back together to allow it to heal. So that's okay. That was all kinds of messed up. Poor little baby guy. So so lots of things that we can find on dental X-rays that you would not necessarily see just by scaling, polishing, and probing.
And so you can see on this picture again, this is all what you could see above.
That's
So,
what's above the gum
Yeah.
line.
So if we had found that there was like a crack or a chip and we thought that this tooth needed to go,
Mhm.
if we hadn't done the dental X-rays, we wouldn't see any of this down
Mhm.
here.
Mhm.
So we would try to take out, you would try to take out that tooth,
Lucky me.
and it could be really
It
bad.
could be really bad.
Yeah.
It could be really bad. So that's why it's important to make sure that you're getting dental X-rays done, and that's why we include them with our dental package. We don't, it's not like a separate thing because it's not negotiable for me. It's a must-have. So
Because
Yeah.
you don't want to break any.
I don't want to
jaws.
break jaws. Maybe I'm weird. Call me crazy. I don't want to break a jaw. So that's important for sure, is the dental X-rays along with all of the rest of it. So and doing good anesthesia, good anesthetic monitoring. I know everybody worries about putting their pets under anesthesia, and it is a little nerve-wracking. I get it. I had my own pet and had to go under anesthesia.
And you put it off for a while.
What?
For Ruger?
Oh, for his teeth. Yeah.
For his teeth.
No, I was talking about for his knee when he had to go.
Oh, yeah.
Yeah. Even though I knew he wasn't, the best hands possible, it still made me super nervous. So I've been there too. I get it. But there's reasons why we have to do it that way, to do a good job and to address what's going on. Yeah, he had to have teeth extracted too last year. So lucky him, poor little guy. So he's missing a couple little incisors on the bottom.
Well, I mean,
It's
even
pretty
Jaeger, he gets a dental, like we said, every it's really like 10 to 14 months, somewhere in there.
Yeah.
And he had, 3 teeth pulled this last time?
I think so.
Maybe more.
Mm-hmm.
And he gets his teeth done every year.
Mhm.
And it just,
He's just got bad luck.
Yeah.
He's a Chihuahua.
yeah.
That's
little
what they
dogs.
do.
And so one of the big things, too, we haven't talked about is a lot of people want to know how often should we get this done.
Mm-hmm.
And it really just depends on your dog.
Yeah.
There's no set, we recommend it once a year,
Mm-hmm.
but that's not practical for everybody.
Mm-hmm.
Like my bigger dogs, they don't get their teeth done every year.
Right.
Because one, it's costly. We
Mhm.
understand
Yeah.
that. And
Yeah.
2, they just don't need it every year. So it really just depends on your dog and their
Yeah.
lifestyle and how bad their teeth get
Mhm.
and what you can
And you have to
afford.
prioritize Jaeger.
Yeah. Well, yeah.
For sure. He gets priority. So, yeah. So what else? Anything else about dentistry in general?
I don't think so.
I think that covers it.
Yeah.
Yeah. So, and one of my favorite questions is he going to be able to eat without those teeth?
Nope.
Nope. Enjoy your last couple weeks with them. But his breath smells better. No. No. We wouldn't pull them if they couldn't eat. We for whatever reason recently have been doing a lot of whole mouth extractions, and there's different reasons why that would happen. Usually it's just end stage dental disease, and there's literally nothing else we can do about it because they've just rotted out of that animal's head. But then there's some cats too that end up with horrific gingivitis and just it's stomatitis, where it's the whole mouth is inflamed, to where getting rid of those teeth is the only thing that we can do, because medications aren't managing it. So really they just have to have all their teeth pulled, which stinks. But they eat just fine afterwards.
They do. They do.
A lot of them still eat hard food even, because let's be honest, most of them aren't chewing anyway.
Right.
If you're like my dog, they're just like,
Inhale it.
yeah.
Yeah.
But just,
Or you
It's like
just
2
add in a
seconds.
little bit of warm water with their
Right.
food for
Yeah.
a couple minutes
Yeah.
beforehand.
Yeah.
Like my grandparents' dog has 3 teeth left. She's also a Chihuahua. She's
And she's still
something.
chunky.
Well,
She
Yes,
eats
she
just
is.
fine.
They do great.
Yeah, so that's, that we don't worry about that at all, but we get that question all the time. Like, no, they'll be fine. I promise you. They don't need those teeth. They don't need that.
They're gonna be better off without
right.
the diseased teeth.
Yeah, without that infection, without that pain, yes, their life is going to be better without those teeth than being worried about saving as many teeth as possible. So, yeah.
My son actually just lost 2 of his teeth.
Yeah.
He also has terrible,
He's got bad teeth too.
terrible dental
It runs in
hygiene.
your family.
Yeah, well, it does. But he just lost 2 of his
Including
teeth,
your dogs.
and I felt bad. I was one of those people that's like, "Oh, is it gonna hurt?" But let's be honest, his teeth probably hurt anyway.
Yeah,
So,
exactly.
and he's acted like nothing. They don't bother him at all.
Of course.
Nope, not at all.
Yeah.
He still eats just as much candy as he did before.
Wow, good job. All right. Well, if anybody thinks of any questions, just leave us a note in the comments. Otherwise, we'll see you next week.